Thanks for your patience, everybody. West Boroughs connecting right now, so we'll just give them one more minute, and you should all have a warning. We are live streaming on North Borough YouTube channel. Ray, can you hear us okay? No, Ray's showing up as Jennifer right now. Looks like they're still connecting. Ray, are you able to hear us okay? Just want to make sure the connection's there.
Yes, I can hear you.
Okay, great. All right, we'll get started then. Thank you. So it being June 14th, 2023 at approximately 2:06, I will call the Greater Boroughs Partnership for Health Advisory Board meeting to order. We are going to start off. I don't have that busy of a budget, so I'm hoping for all of you will be done in under an hour. It's really just updates. Again, we're meeting quarterly on the year, 4 times a year, but we did have a special meeting last month to go over the public health excellence budget, which was submitted. We haven't heard anything back from the state, but that should be good to go. So first on the agenda is our local health support for COVID-19 case investigation and contact tracing grant with our fiscal year planning budget for this year. So Isabella, would you mind sharing the slides? Great. So I'll do a quick recap. I want you all to remember, you should have received an email. I want to say it was back in the spring or late winter, where the state did modify our allowable expenses and provide a little more clarity as contact tracing requirements were decreased. We were looking to understand what other public health projects we are able to complete. So this slide, you should have all received that updated scope of services, but there's just a quick recap on allowable expenses for this grant. So one of the things we'll talk about today is a community health assessment, strategic planning, and community health improvement plan are allowed expenses. The plotter scanner, septic planning, scanning is possible allowed expense. Maternal and child health programs that we talked about before was deemed an allowable expense. Tobacco control, if we need additional contracted compliance checks. I know Westboro is now officially part of the Metro West Tobacco Collaborative as well as Southboro, but Northboro and Boylston were not able to join during that recent cycle. So we did inquire if there would be allowable expense if we needed assistance with those tobacco compliance checks. And then we did ask some questions about whether Health and Human Services tracking software would be an allowable expense. We were thinking through the home wellness checks and whether there were other ways we'd want to try to track visits by nurses and any referrals made. So thank you to Isabella, who took some of this input and requests from our towns and did submit those as whether or not they were allowable. Next slide, Isabella. So here's just our framed out budget for the contact tracing. So again, the core of this originally, just to go back, this was an add-on grant that we received after we received the original public health excellence grant. So this grant is for $160,000 per year. It was really only supposed to be for 2 years, but we did have a rollover allowance. And then last minute, we heard that they were going to give us a 3rd year of funding. Rough numbers we're anticipating from this year's fiscal year 23, anticipate we'll be rolling over just under $100,000. We had originally had a full-time nurse under this contact tracing grant, and that contact tracing demand just really dropped, as you all know, as we no longer had to make those calls. So that money was not expended. And so we're looking at a surplus. So that's why you're going to see at the total, this screenshot here, total grant amount of $260,000 for next year for our contact tracing. So we plugged in some ideas for what we're looking for. One is, again, all of our staff on this grid, so Isabella's our epidemiologist, was moved over to the PHE grant. So you're not going to see epidemiologist here, but she is supported through the other grant. So the only staff that we'd be maintaining off of this contact tracing grant, which is over and done with after this year. We're being told that don't be hopeful, there's no chance of another carryover. Is our contracted public health nurse, Penny Giacobbe, at 24 hours. So Penny's supporting the towns of really Boylston. She's been doing blood pressure clinics over there and contact tracing support to the 3 towns, and is also available, obviously, if Westboro had needs where Jim needed additional support. So Penny's position, again, is 24 hours a week. So we base that as the 52,000 line item. We did include an additional per diem nursing services line item at 15,000 as a placeholder. So if there was a need for additional nursing to come on over time of current nurses or things along those lines, there'd be some wiggle room there. We talked about office and program supplies, including printing. So we don't have a very robust supply budget currently in our PHE grant. So we want to leave that room, especially as we'll talk about a little later, our health communication plan, the ability to print posters or other deliverables for our communities. We budgeted a small amount of money for tobacco compliance consultant if Northborough and Boylston did need that. Right now, Michael's feeling pretty confident, but the one thing that our individual towns can't do that aren't part of the collaborative is to do those underage checks, and hire a youth that would actually go in and do those sort of sting operations. So that's a placeholder there. We budgeted a technology budget for possible hardware, software. That's again a small amount. We're thinking if we did want that tracking software for the home wellness checks, for example. We put in the majority of the money is towards a community health and assessment / strategic plan or community health improvement plan. One thing we've been talking about offline and even at our last meeting is whether or not we would use some of our data that's available. As many of you know, Metro West Health Foundation is currently completing a community health assessment that's fairly robust. I know that doesn't include Boylston, but Westboro, you're included, Southboro. I think our boards of health have all been helping to push it. One goal we had is, wow, this will be current. Metro West paid for all that survey work to be done. Could we contract with a third party like JSI, who just did Worcester's Community Health Improvement Plan, or that's John Snow Institute. HRA is currently doing the Metro West Health Assessment. That would be a procurement process, but we could use that data and bring in a group to do additional focus groups in Boylston, where there'd obviously be some data gaps, and to really try to come up with that health improvement plan being a one-off option. And then lastly, the last line item there is to include maternal and child health program. So there is that new baby model program we're seeing in some of the bigger communities, but we're looking to model off that state program to see if we can work in our communities to offer sort of that new baby check with contracted nurses through SAM and VNA that are already running a maternal child health program right now and have skilled nurses. So those are really ideas. It's a placeholder, and I'll turn it back to the group if there's thoughts about those budget line items. So Heather.
Hi, Kristen. I think last meeting of this group, we were also talking about one of the CART recommendations about standard operating procedure for backup documentation. And then we also had talked about digitalizing some of the paper files in our health department. So I just wanted to ask on the status of those two.
Those aren't included in either budget right now. I think in discussions, we were leaning more towards the health improvement plan, but if people were not, both of those, digitizing files across the 4 towns could be very expensive. And I would think it would be an either or, whether or not the health improvement plan was a top priority. Again, either digitizing or the community health improvement plan is going to require a procurement process through the town. So we could move forward to one or the other, whatever the group was most excited about doing for next fiscal year. And I think the other project could stand as a backup. So I think we could be open. And if, let's say, the health improvement plan, if it didn't get off the ground, we could definitely go back to the state. They've been pretty flexible and reallocate mid-year. So while we have to submit a budget that shows the full use of the 160 and the additional rollover amount of 100, we have to come up with a plan to use it. We can make modifications, and with the state's approval, we could allocate it towards other projects. If the community health improvement plan came in less, we could see if there's a surplus, bring it back to the Greater Boroughs Advisory and look to do a digitizing project or purchase supplies, those sort of things.
And the standard operating procedures, those were in the PHE grant. We did include that.
Okay, great.
Ray, I like putting Westboro on the spot. I know you guys have penciled some money on a health improvement plan or a CHA. Do you know if you're still proceeding with that, or is that something you'd be interested to do collaboratively through Greater Boroughs?
At this point, I haven't been involved in that. We're short-staffed again, so I've been on the road most of the days, so I don't know what Jen's working on.
Okay.
Today was a sewer outbreak, so you'll hear about it. We had sewer, they think 76 gallons over 76,000 gallons over the last week and a half have put into Jack Straw Brook. So I was out all day on that. And then I just got back to the office a little while ago and Jen said, get on this for me. So that's why I'm on. So I don't have any answers for that for you, but I'll make sure Jen will check on that for you.
Okay. Yeah, if I can, I remember there was a reference, maybe ARPA funds or something in Westboro, but again, we do have the recent health assessment with Metro West. Last we had checked, Isabel, I know we inquired about Northborough in particular, how many responses do you remember?
It was over 100, 120 maybe.
Okay, I mean, hopefully your other towns are up there too, so that would be a robust. So a lot of communities, smaller communities like ours, haven't had the opportunity to really make a health improvement plan to sort of drive the focus of their board, just because it is an expensive project. So that's where we put it on the books, but we're open to making modifications. And then it also depends on vendors on these bigger projects. If anyone's available comes through, they're on target, but we might need to go back to the drawing board if that didn't come through. Any more questions on the budget, the draft budget as you see on the screen? So I know we are an advisory board. There's not a formal process of like voting and approving, but are you, I guess, with a nod of hands or a thumbs up, are you guys comfortable with submitting it as proposed with the community health improvement plan as a focus for this coming fiscal year? Okay. All right. And we'll come back to digitizing files or all those other things, I think, at our next meeting in the fall. This will have to go through and actually get approved, and then we'll start those processes and keep you all involved in that, with Isabella's weekly communication and see where we go from there. So, okay. No further questions on the fiscal year 24 budget. Isabella will be submitting it as shown here. I think it's due actually tomorrow. So this was good timing to meet today, and we'll see where this shakes out and let you all know. Thank you. Our next Metro West Health Foundation is doing community health assessment. We mentioned that already on the agenda. We just want to remind all of you the updated deadline to submit responses for our residents, with the exceptions of Boylston, is for June 16th. If you're a non-resident, you actually just time out and you're not even able to submit a response. So if you, any of you can just continue to push that to your community through Facebook, town news, libraries, senior centers, involvement in that health assessment. That data will be important for all of our towns. And just as a reminder, in the past, Metro West did that for the hospitals. It was really a partnership. This time around, the hospitals aren't part of that process. So this data is really being collected locally for us as local boards of health and various other health agencies in our organization. Any questions on the Metro West Health Foundation Community Health Assessment? Okay. And I'll turn it over to you, Isabella, to talk to the group about the health communication plans.
Okay, so we're on month 2 of working with the APHC, which is the Academic Public Health Corps. So our first topic was sun safety and skin cancer. And then our second one was men's health, and they focused on anxiety and depression. So every month, how this will work, I will send out the flyers and or social media posts that they send us, and you are more than, please put that wherever. It will be on the Greater Boroughs website. We have a new tab that says health education. So that will always have the most up-to-date flyers. We plan to keep them all there. So every single month we'll keep adding. And then Erin, if you want to just talk about we're going to be printing these as well.
Yeah. So we have contacted a printer that Kristen has used in the past, and they're currently making a few copies of each of these for all of the towns. So once I have those, I'll be in touch with the nurses, and then you could put them wherever you'd like in each of the towns. And then my thought was, at this point, we would do about 4 of each of these for each town, and then we can customize that a little bit more. They're going to be the 11 by 17 size. If we want to get poster frames, we talked about that. If we want to make them bigger, we can do that. If you think you only need 2, but you'd like them bigger versus 4 of the 11 by 17, that sort of thing. But because we were trying to just get things going, we sent them off in that size and that amount for now, to kind of see what we get, understand the quality, and then be able to figure out where we're going to put them and make some changes from there.
Yeah, so if anyone has special requests of like size or what type of poster, feel free to send them to either Erin or I, as well as any topics that you would really like. I can send a list of like all of the months. We basically just picked, if it was an awareness month, like one of those. So I think like breast cancer is October, things like that. So July is Healthy Vision Awareness Month, and then August is National Immunization Awareness. So the one specific to August will be about school age students, hopefully to get everyone up to date before the school year starts. Does anyone have any questions about like working with APHC or the posters or website? Perfect. So with health communication, Erin and I have been working to create a Facebook, Instagram, and Twitter account for Greater Boroughs Partnership for Health. If you Google them all right now, they will be very much blank. But this is our progress or goal this summer, to really create a social media presence for our communities. And we will be posting the APHC material as well as material that is available through like CDC, MDPH, things like that, reputable sources. So just to give you an update, and hopefully we'll have more posts and all of that soon. Does anyone have any questions about this? Very exciting.
So just a quick comment on this. As many of you know, I'm not a big fan of social media personally. But we know it's a really important tool, and we know when we send all of you the infographics and the flyers, it's extra steps for all of you to take a document and then share it on social media. So we're hoping by having our shared staff actually be the one to post it on account, it's easier for you to like, retweet, share, ask your fire department to share a post, that sort of thing. So we're definitely open to your feedback about how it's working for you, or how do we help you make it easy to post on your various town accounts, or other ways that you'll be looking to distribute this information to the public, if it's through the schools. So we're very much open to feedback. Our goal at this point is to post maybe 2 to 4 times a month, really following, reposting anything that is most appropriate, thinking Mass DEP, Mass DPH, the CDC, EPA, those sort of things, and just resharing information from those state and federal sources, not making up all that much content on our own, but really linking to reputable state and federal sources of information. But, the fun part is obviously working with APHVC, or APHC now, to have those interns, customize or make things for us, linking to reputable sources, making attractive documents, posters, making this all really come together. And I want, think creatively. If your food bank, food pantry, we'll talk about that in a little while, if they're willing to, have a bulletin board or posters, or library or senior center. So really think through, the funding is there. And if you need more things printed, or you want things in different formats or different frequencies, please provide that feedback to the shared staff. Thank you.
All right, I think that was the update on health communication. So public health nursing.
So on our agenda item here, really talking about CPR and AED classes, as well as software for tracking referrals. So the CPR AED, Erin, I'll hand that over to you.
So far with that, Taylor and I were able to attend a class a few weeks ago to start the process to get our instructor cards, and we're we've been doing some research on the equipment and figuring out how much and in what we need to purchase. And with that being an approved purchase, we'll be ordering all of that stuff soon. So our hope is by the fall, we'll be up and running. There's some other steps we have to do. We have to do a CPR class that we are monitored by a current instructor. So, just kind of getting all those things rolling through the summer. Hopefully we'll have all the equipment and everything and be able to go by the fall. Sorry.
And just a little further on that, so the state did approve under our contact tracing grant for the purchase of up to or around $10,000 to purchase all the mannequins and all the associated equipment and lung bags and things like that, as well as the AED trainers. So we're looking to complement what's already happening in your community. We know fire departments have been offering this, for example. One thing we're looking to model in Northborough, we've been offering these free or reduced cost courses at the libraries has been really powerful. People want to take a course, they don't want to drive really far. And I know some of your fire departments or other groups that are offering these courses might not have the bandwidth to necessarily offer it for the public every single month. So look for a kickoff sometime in the fall. We'll talk more details with the group. We're looking to, our goal is to be able to offer the course with a card for only like $20, which if you look to take it anywhere else, it's typically a lot more money. I mean, maybe we've got to run the numbers and see where we are. Luckily our nursing, I don't want to say our staff time is free, but they're covered under the grants. The equipment would be covered. So really our cost is the card and some small like credit card administrative fee. We'll likely be running it through the rec department or some other way. We've been modeling this off of Needham. Needham's been running a CPR program through their health department. And so we're looking to see how others do it. And it's a learning process, but our goal would be to offer really low cost AD CPR courses for the public about once a month in the region, and we'll see where we go from there. So if you have a need, but I think optimistically starting September, I think would be the earliest. And hopefully that's a good time with this kids sports and new jobs and other things where people would need those courses. Okay.
Taylor and I had also talked about incorporating EpiPen training and Narcan training into those courses as well.
Awesome. Any other questions on CPR AED classes? Okay. So software for tracking our referrals for home wellness checks. So one of the things, our public health departments haven't really been health and human services. So we've operated in such a way we don't really think about how many visits and referrals and really how are we connecting. But I think it's going to be an important measure of really what are our health departments doing, especially as we look to maintain these programs in future years. So our goal is that we'll try to find an easy software solution. I understand our current nurse, for example, in Northborough at our senior center clinic, they use the My Senior Center software that's already there at the senior center where they'll actually document a visit, blood pressure check, and document those things. So we're inquired with the My Senior Center software company, and we're looking to see if they could also track home visits with our nurses. And I understand, I believe, you can correct me if I'm wrong, Heather, I think Southborough Youth and Family might be looking to work with them as well. So it seems like they're more robust than senior center software. We're trying to find a software that's not really complicated or set up for insurance billing and see what's already available in our towns. And can we use it to track our progress?
I have like specific ones for nursing. If we can talk about it offline, but from other communities, I know I don't think they're a huge fan of that software for nursing, but I have other recs that I can give you offline.
Okay, that would be awesome. Yeah, and if you want to inquire with your towns, if they are using any software, have recommendations. I think we'll have the nursing team that they'll be the ones entering it, really take a look. Our goal, again, it's in the budget for next fiscal year. So sometime after July, we'd be looking to decide on a software and, begin tracking. And that would obviously be shared with all the nurses, including you, Anne. We're not excluding from you. I know you're not officially in Greater Boroughs, but the goal is we'd be able to set up enough user accounts for anyone that would be providing those services. Okay. Any other question on the software? All right, so moving right along, this is the exciting part. I'm going to hand it over to Gabriella, and she'll talk to you a little bit about her project. So again, quick reminder, Gabriella comes to us. She's working on her master's in public health at Boston University. We are very fortunate to be one of the less than 20 local boards of health that were assigned a DPH intern this summer. And we're excited to have Gabriella. She's at least on week 2, if not 3. And 3, yep, we're there. So she'll talk a little bit about her project. So thank you.
Thank you, Kristen. Hi, everyone. So as Kristen introduced me, my name is Gabriella, and I am the Department of Public Health intern for Greater Boroughs Partnership for Health this summer. I've already received a very warm welcome from Kristen and Isabella and Aaron and everybody over in Northborough. It is my 3rd week, and this summer I am working on a project in food insecurity. So mainly in the past couple of weeks, I've been compiling a lot of resources about all of the food pantries, organizations in the area, any community meals, community fridges, and any other kind of food related and food access resource that is located in any of the towns. And one of our goals is to be able to understand what resources are available, what resources already exist, and how they complement one another. And then what I'll be working on, again, is creating a resource and guide that can be distributed to people in the community so that they can know exactly where to find different resources and social support services for signing up for things like SNAP and WIC and lots of other different food access resources and supports. In the next couple of days and in the next couple of weeks, I'll be reaching out to the different local organizations, starting with the food pantries. So when I reach out to those organizations, I will CC the health director in the respective towns. So if you see an email from me, any communication from me coming in soon, that is what that is all about. But I'm really excited to work on this project, and I'm really excited to be here this summer. It's very nice to meet you all, and thanks for having me today.
Welcome. Thank you.
And just Gabriella's worked really hard on sort of an interview list that she'll be asking at the food pantries. So really, what are their requirements? What days? Where are their residents? Where can people come from? Do they have, fresh produce, dairy, meats? Just so we can really make sure to help people understand what's available. And so our goal is in the end, like Gabriella said, it would be like a resource guide or a resource page on our website. So we could hopefully have things like a postcard just about food insecurity in our towns and any like a related resources. So if you have ideas of like, hey, I'm interested in this project and where you could use it, please reach out directly to Gabriella, or you could reach out to Isabella, and we can think about ways that we can make sure that works for your audience or how you think you might use this information. So we're excited about this project. This is going to check some boxes for us. As you know, really, we need to have this health equity focus as we move forward in public health, and part of this work and thinking about translation of materials and other things will be hopefully addressed with Gabriella's summer internship project. So, all right. Thank you, Gabriella. So what do we have next here? Oh, on our agenda, opioid settlement funds. So I threw it on the agenda. I know it's more just like a placeholder. Anyone, what are your towns doing? Any great ideas that you'd want to share at this point? Ray, I see you smirking. Are you having fun with this in Westboro right now?
It's crazy right now. I mean, our amount that we're getting is nuts, and to find where you can use it and how they're allowing you to use it, it's just very tight. We got the case of some opioid, some stuff that we're supposed to be giving out. Jen's been meeting with the fire chief and the town manager and trying to find out where we have Spectrum in town, whereas probably 90% of our opioid related cases, and that's a private facility. So we're trying to figure out how we can use the funds along with them and catch the 10% that are in the town and go from there. So, I mean, that's the issue we have. We do have a large number we've had opioid overdoses and everything, but I have to say that the majority is at Spectrum, which is the ones that are handling the situation. So it's like, I know that Jennifer is going crazy, trying to figure out where she's going to put all this stuff. And she comes back from a meeting and she's flustered. So I try not to talk about it. And so when you mentioned it, I was like, oh, now I know why she wanted me on the meeting and not her.
I can speak, in Northborough, we're sort of at the same point, Ray, where we're meeting internally with different departments. One direction we're doing some research on is providing or purchasing curriculum in the public schools. It's a little messy in Northborough, Southborough, we have a shared high school. So the high school are waiting until Southborough has access to their funds to see what their needs are. But we're in communications with our middle school principal, as well as looking at the elementary. And, the question is, if we find this curriculum, there are some, is it even approved? I don't even know if we have a point person to ask for sure. So I'll be finding out that info hopefully soon. I actually did get a call from one of our staff members at the school saying, I have this curriculum for the elementary. Do you think this is an allowable cost? Because some of it was more social emotional learning, mental health, but it's pretty loose about how it's written in the allowable use. So that's something we're considering in Northborough. The other thing we're doing is just, again, trying to highlight what's already out there. We're sort of planning a postcard to go out, or a full-size flyer in July once we have access to our funds, to, for a couple of purposes, really to let the town know we received these opioid settlement funds, that we want to include a form there where people who are of direct experience, either in recovery or those affected, because that's a requirement, right? If you look at the opioid use funds, you have to solicit input from those directly impacted with opioid use disorder. And so we're hoping to use that as a form on a postcard that goes to direct every household to highlight resources around substance use recovery. So really modeled off the cards that the nurses have been giving out, the Narcan training. And then on the back, really to highlight the free fentanyl strips. What is fentanyl? What is a fentanyl strip? What is harm reduction? As well as highlighting our Narcan, free Narcan program and distribution. So I am happy to share all of that with you if you think that's something that your town, because again, the fentanyl strips are available. The nurses made a beautiful little way. We have those in town hall now. We have a few locations where the fentanyl strips are being distributed. And so we're just looking to really just draw awareness and go from there. And then there's bigger conversation, those big ticket items of, would you hire a part-time, recovery coach, and all of those. I think we'll get there, but right now we're hoping curriculum would be something that would be approached. In Northborough, approval would be through our Board of Selectmen. So any other towns want to talk about what you're doing, or an opioid use?
Kristen, this is Chelsea. I think from the Southborough side, I would be very interested in what Northborough is doing in terms of the schools, especially where we're a shared district. So as you get more information on that, I think that would be helpful. The one other thing I would add is that we did not allocate funds at town meeting. So that we'll have to do in the fall.
Thanks, Chelsea. Okay, yeah. One more thing for local boards of health, right? But no, hopefully we can come up with creative solutions. And if you hear of anything, or you want to do a special meeting on that, or a working group or whatever, just please reach out to Isabella or the nurses, and hopefully we can help one another in addressing how to best use those funds to have an impact. So let's see, moving along, approval of our meeting minutes from May 17th. Thank you to Isabella for doing the draft minutes. I don't know if we have a motion to approve those.
Just a very small point. Sarah, for her last name, Barrett, like in the body, it sometimes didn't have the E at the end, but it did in the attendance.
I will fix that. Thank you.
Yeah, there is an E at the end.
We want to do a motion to approve those minutes.
A motion to approve the May 17th minutes.
I'll second.
Thank you, Sarah. And Heather, any discussion on the minutes or additional edits? Aside from the correction of Sarah's last name spelling. Thank you for that catch.
Nope.
Okay, so we will need to do a roll call vote for approval of the meeting minutes. Kristen Black, aye.
Heather Alker, aye.
Sarah Barrett, aye.
Okay, and those minutes would pass. So thank you very much. Those are approved. Next on the agenda, confirming our future meeting dates. You should all have that shared Outlook calendar. Those are all the way through. If you want to double check, our future meeting dates would be September 13th, December 13th, March 13th. I guess we don't change the dates much, and June 12th. So all of those are on our agenda. If you want to take a look in your calendars, it should be as a saved Outlook invite. We can talk closer to if we want to meet in person in September or stick with the Zoom. Assuming that's still allowed. So that's about it. And question, any reason that those dates are concerned at this point, or we'll keep them on the books as is? Okay.
Kristen, the only comment I would have is if we were to meet in person, that time is just tough for me with kids getting out of school. So, I mean, I can obviously still dial in if need be, or go to the beginning of the meeting, but I wouldn't be able to stay until 3.
Okay. We'll keep that in mind if we look towards moving in person. I think we'll have to see where we are with deliverables and nursing staff and projects, and a hands-on session might be helpful as we get some of these things off the ground, but we'll keep that in mind and maybe move it earlier in the day if we were to meet in person. I appreciate that, Chelsea. Okay. Is there any other business to come before our advisory board here today? Okay. Well, I'll move to adjourn our meeting.
Second.
Okay, all those in favor, roll call vote. Kristen Black, aye.
Heather Auger, aye.
Sarah Barrett, I. Excuse me.
Well, thank you all very much for your time. Enjoy the summer. For a few of you I might not see between then, and we look forward to your feedback, and we'll continue to keep you up to date with weekly emails through Isabella, and many updates coming from Gabrielle as well with that project. So thank you all.
Thank you.